Okay, so today we're inserting an NG tube, which is nasogastric tube. Your supplies that you need are a 60 ml syringe, a cup of water with a straw for the patient, emesis basin, gloves, proper tubing, stethoscope, tape, towel for the patient, and water-soluble lubricant. Alright, our first step for insertion the tube is the identify yourself with the patient, hand hygiene, and verify the 7 rights. And explain the patient the process and what you're going to be doing. So now you can get your tape ready and the remaining of your supplies. Your tubing is ready. Now you're going to check the bowel sounds. Okay, and check for patency of the nose. Ask if there's been any past facial trauma or surgeries. Put on your gloves. And now you want to measure the length of the tube from the nose to the ear and down to the xiphoid process. You can have a marker with you or a pen and mark the spot on the tube. Next step is going to place the towel, lubricate the tip of the tube, and then inform the patient that they will need to swallow when you start telling them to. Alright, now you want to lean the patient's head slightly back to insert the tube until you feel resistance. Once resistance is felt, tilt the patient's head forward, allow them to swallow as you quickly insert the tube. Okay. At this point you can tape and secure if you would like. Okay, now we can go ahead and verify for placement. First you would need to push in 30 mL of air to make sure the tube is off the wall of the stomach, and then aspirate 10 to 15 mL of the gastric contents. Unclamp yourself. Clamp it and put your contents into your emesis basin for pH testing, and put the clamp in the tube. Okay, at this point you can test the pH of your contents, and if you have an order, you can go down for x-ray to verify placement. If your patient is to go on wall suction, you can attach your tube to wall suction at this point. Make the patient comfortable and thank them for their time.